Hello friends, welcome to BMH Learning. In this video, we are going to discuss about anti-Smith antibodies. So, these antibodies are a type of anti-nuclear antibodies. Now, the most important thing about these antibodies is that they are associated with systemic lupus erythematosus. Occasionally, it's also found in mixed connective tissue disease. As stated, these are a type of anti-nuclear antibodies. That means they are developed against nuclear proteins. And these nuclear proteins are named as Smith antigens. So, the Smith antigen is a known histone nuclear protein which is formed of many polypeptides with different molecular weights. Smith antigens along with other RNP antigens are actually part of snRNAs, that is, small nuclear RNAs. Unlike RNPs, the Smith antigen is resistant, or we can say not susceptible to RNAs. But they are partially sensitive to trypsin. Now let's talk about the important topic, interpretation regarding these antibodies. Anti-Smith antibodies has low sensitivity for systemic lupus erythematosus. That is, it's not sensitive because it's present in only 30% of patients with lupus. So that means you could be one of those 70% patients who still have lupus even though they don't show any Smith antibodies. But this antibody has high specificity for lupus. It only occasionally present in mixed connective tissue disease. So you must remember here, the antibody is very specific because it's found specifically in lupus mostly. Having said that, anti-Smith antibody levels are mostly elevated in 30% of systemic lupus erythematosus cases and 8% of mixed connective tissue disease cases. Anti-Smith antibody is more common in blacks and Asians with SLE than in whites with SLE. Now, if you are anti-Smith positive, the probability is that you are also anti-U1 RNP positive. You should note one thing here. The elevated levels of anti-Smith antibody persist even after the levels of anti-DNA have returned to the normal value. This fact is quite useful when you are testing a patient who is showing few signs or symptoms of SLE. Now let's know in what conditions or symptoms you must consider testing for anti-Smith antibodies. So the following symptoms would guide: when you have discoid rashes, when you become photosensitive. You should go for this test when you show symptoms of avascular necrosis, and when you have arthritis, or you are suffering from serositis, also glomerulonephritis. This was all. Thanks for watching.